If you're over 50, there's one stroke warning sign that many people completely miss. It doesn't involve collapsing. It doesn't involve severe pain, and it often appears during an ordinary moment. You might be enjoying your morning coffee, watching the morning news, getting ready for your daily walk, or talking with your spouse across the breakfast table. Then suddenly something seems a little off. A smile looks uneven, words don't come out quite right, or a hand feels unexpectedly weak. Many older adults brush these signs aside. They assume they're tired, stressed, or simply having an off day. But according to the Centers for Disease Control and Prevention, stroke remains one of the leading causes of serious disability among older adults. And when it comes to stroke, acting quickly can make a major difference. Because for many adults over 50, the real fear isn't just surviving a stroke, it's losing independence afterward. The ability to drive, to walk confidently, to enjoy retirement, to spend time with family, and to continue living life on your own terms. That's why in today's video, I'm going to show you 7 warning signs every adult over 50 should know, including one symptom many people mistakenly ignore because it disappears on its own. And later, I'll show you a simple 60-second check recommended by health organizations around the world. Let's start with the warning sign families often notice first. Before we get into the warning signs, let's talk about why this matters so much after the age of 50. One reason stroke becomes more important as we age is that it can affect the very things that help us stay independent. Walking confidently, maintaining balance, driving safely, speaking clearly, managing everyday tasks, and enjoying an active retirement. That's why protecting your brain health is every bit as important as protecting your heart health. According to the American Stroke Association, stroke risk increases with age, which is one reason health experts encourage older adults to learn the warning signs before an emergency happens. The good news is that many strokes provide warning signals. The challenge is that those signals are often subtle. They don't always look dramatic, they don't always feel painful, and they often appear during completely ordinary moments. That's why knowing what to watch for can make all the difference. And here's something many families don't realize. A stroke often doesn't begin with pain. Instead, it begins with the sudden loss of an ability you had just moments before. Which brings us to the first warning sign. Warning sign number 1 is an uneven smile. This is often one of the earliest signs families notice. Imagine you're sitting down for breakfast with your spouse. You're talking about your plans for the day, and suddenly something looks different. One side of the face doesn't move normally. One corner of the mouth appears lower than the other, or the smile simply looks uneven. Many people assume the person is tired. But facial weakness is one of the most common stroke warning signs. If you ever notice a sudden change like this, ask the person to smile. A healthy smile should look balanced. If one side refuses to move properly, take it seriously. But facial weakness isn't the only sign many adults over 50 miss. The next warning sign often shows up while doing something as simple as holding a coffee mug. Warning sign number 2 is arm weakness, and this one can be surprisingly easy to overlook. Many adults over 50 expect weakness to feel dramatic, but that's not always the case. Sometimes it feels more like heaviness. You may suddenly struggle to hold a coffee mug. A television remote slips from your hand. A grocery bag feels much heavier than it should, or one arm simply doesn't seem to cooperate the way it normally does. This happens because a stroke can interfere with the brain's ability to control muscles on one side of the body. If you suspect a stroke, ask the person to raise both arms straight out in front of them and hold them there for several seconds. If one arm begins drifting downward without control, treat it as a medical emergency. For many older adults, this weakness appears suddenly, not gradually, not over weeks or months, but within moments. And sudden changes are exactly what make stroke warning signs different from normal aging. Warning sign number 3 is a sudden change in speech. This is one of the most important signs to recognize because family members often notice it immediately. The person may know exactly what they want to say, but the words don't come out correctly. Speech may sound slurred. Words may become mixed up, or they may suddenly struggle to complete a simple sentence. According to the National Health Service in the UK, speech changes remain one of the most common stroke warning signs identified during the F.A.S.T assessment. A simple test is to ask the person to repeat a short sentence. For example, "The sky is blue." Listen carefully. Do the words sound slurred? Do they substitute the wrong words? Can they repeat the sentence at all? Even a small change should be taken seriously. One thing I want you to remember is this. Stroke symptoms usually appear suddenly. A person who was speaking normally a minute ago may suddenly struggle to find words. That's why waiting to see if things improve can be so dangerous. But the next warning sign may surprise you. It doesn't affect your speech, it doesn't affect your arms, and many adults over 50 mistake it for a simple eye problem. Warning sign number 4 is sudden vision loss. And this is one of the most overlooked stroke symptoms among older adults. Many people assume it's simply an eye problem. But sometimes the issue isn't the eye at all. It's the brain. Some people describe it as a curtain suddenly coming down over part of their vision. Others notice blurry vision, double vision, or difficulty seeing clearly out of one eye. The important thing is that the change happens suddenly, not gradually over weeks or months, but within minutes or even seconds. If your vision suddenly changes without explanation, don't assume it will pass. Take it seriously. This is one reason brain health becomes increasingly important as we age. What appears to be an eye problem can sometimes be a warning sign coming from the brain itself. Warning sign number 5 is a sudden loss of balance. This warning sign is especially important for adults over 50 because balance and mobility play such a major role in maintaining independence. You may suddenly feel unsteady while walking. You may struggle to walk in a straight line. Or you may experience dizziness that seems to appear out of nowhere. Now, not every episode of dizziness means a stroke. But when balance problems appear suddenly and are accompanied by other symptoms we've discussed today, they should never be ignored. Many people describe this feeling as if the room suddenly shifted around them. Others feel as though their legs no longer want to cooperate. For many retirees, mobility means freedom. The ability to go shopping, visit family, travel, exercise, and enjoy everyday life. That's one reason sudden balance changes should always be taken seriously. A retired gentleman once described feeling slightly dizzy while taking his usual morning walk. He almost ignored it. After all, it didn't seem serious. But within a short time, additional stroke symptoms began appearing. That quick decision to seek help made all the difference. And the next warning sign is one that families often mistake for simple forgetfulness. Warning sign number 6 is sudden confusion. This symptom can be especially difficult to recognize because many families assume it's simply forgetfulness. But there is a major difference. Normal aging does not suddenly appear in the span of a few minutes. Stroke symptoms often do. A person who was having a perfectly normal conversation may suddenly seem confused. They may struggle to understand what you're saying. They may answer questions incorrectly, or they may seem disoriented in a familiar place. According to the CDC, sudden confusion can be an important stroke warning sign, especially when it appears alongside other symptoms we've discussed today. The key word is sudden. A rapid change in mental clarity should never be ignored. One of the most important lessons in this video is learning to recognize sudden changes. Stroke warning signs typically appear quickly, and when something changes quickly, it's always worth paying attention. Warning sign number 7 is a sudden severe headache. Now, not every headache is a stroke. Most headaches are not. But health professionals pay close attention when someone experiences an extremely severe headache that appears suddenly and has no obvious explanation. Many people describe it as the worst headache they've ever experienced. Others say it feels completely different from any headache they've had before. This warning sign is especially important because some strokes involve bleeding in the brain. And in those situations, severe headache can be one of the earliest symptoms. Remember, stroke warning signs don't always appear exactly the same in every person. Some people experience only one symptom. Others experience several at once. What matters most is recognizing that something has changed suddenly. So let's quickly bring everything together. You've now seen 7 warning signs every adult over 50 should know. But what if you're standing beside a spouse, friend, neighbor, or family member, and you're not sure what to do? Fortunately, there is a simple 60-second check recommended by health organizations around the world, and it can help you identify some of the most common stroke warning signs in less than a minute. If you've watched this far, here's the section I hope you'll remember years from now. Because when a stroke happens, people often panic. Family members become overwhelmed. And in those moments, having a simple plan can make all the difference. That's exactly why health organizations such as the NHS continue to promote something called the F.A.S.T test. It's quick, it's simple, and it helps identify some of the most common stroke warning signs in less than 60 seconds. F stands for face. Ask the person to smile. Does one side appear weaker than the other? A stands for arm. Ask them to raise both arms. Does one arm drift downward? S stands for speech. Ask them to repeat a simple sentence. Can they speak clearly? Can they repeat it correctly? And finally, T stands for time. If you notice any of these signs, it's time to call emergency services immediately. According to the American Stroke Association, every minute matters during a stroke. That's because brain cells begin dying when blood flow is interrupted. The faster treatment begins, the better the chance of preserving important functions like speech, mobility, balance, and independence. I want you to do something simple. Take 10 seconds and mentally rehearse the F.A.S.T test. Face, arm, speech, time. You don't need medical training to remember those 4 letters, and one day they could help you protect someone you love. Many stroke survivors receive help because someone nearby recognized the warning signs quickly. Now let's talk about one of the most dangerous stroke warnings of all, because unlike the symptoms we've already discussed, this one often disappears completely. The person suddenly develops stroke symptoms. Maybe their speech becomes slurred. Maybe one arm feels weak. Maybe their vision changes. Then, just a few minutes later, everything seems normal again. And that's exactly why so many people make a potentially life-changing mistake. This condition is called a TIA, or transient ischemic attack. Many people know it as a mini-stroke. A mini-stroke happens when blood flow to part of the brain is temporarily interrupted. The symptoms can look exactly like a stroke. The difference is that they often disappear on their own. According to the Heart and Stroke Foundation of Canada, a mini-stroke should always be treated as a medical emergency, because it may be warning you that a larger stroke could be coming. Think of it this way. A mini-stroke is not a problem that solved itself. It's a warning signal. Your body is telling you that something may be seriously wrong. Unfortunately, many adults ignore mini-strokes because they feel fine afterward. The symptoms disappear, life returns to normal, and they assume the danger is past. But feeling better is not the same thing as being safe. That's why every suspected mini-stroke deserves immediate medical attention. I want you to remember this one sentence. If stroke symptoms appear and then disappear, Do not celebrate. Investigate. Call your doctor, seek emergency care, and get evaluated as quickly as possible. That simple decision could potentially prevent a much more serious event later. The good news is that recognizing a mini stroke gives you something incredibly valuable. Time. Time to identify the cause, time to receive treatment, and time to potentially prevent a more serious stroke. By now, you know the warning signs, you know the F.A.S.T test, and you know why a mini stroke should never be ignored. But there are still 3 mistakes families make every day during a suspected stroke. And unfortunately, these mistakes can delay treatment when every minute matters. Mistake number 1 is waiting to see if symptoms improve. This is by far the most common mistake. A person notices facial drooping, speech changes, weakness, or confusion, but instead of calling for help, they decide to wait. Maybe it's stress, maybe it's fatigue, maybe it'll go away. The problem is that every minute spent waiting is a minute that valuable treatment time may be lost. Mistake number 2 is driving yourself or a loved one to the hospital. Many people think this will save time, but emergency medical teams can begin assessment immediately. They can communicate with the hospital while en route, and they can help ensure the patient receives the fastest possible care. That's why calling emergency services is usually the safest option. Mistake number 3 is deciding to lie down and sleep it off. Sometimes people hope they'll feel better in the morning. But if a stroke is occurring, valuable treatment opportunities may be missed while they sleep. If symptoms appear suddenly, don't wait for tomorrow. Seek help immediately. When it comes to stroke, you don't need to know everything. You simply need to recognize the signs. Remember F.A.S.T and act quickly. And that brings us to the most important takeaway from today's video. If you remember only one thing from today's video, let it be this. Most strokes don't happen in a hospital. They happen during everyday life. While having breakfast, watching television, talking with family, taking a walk, running errands, or enjoying a normal day in retirement. And in those moments, recognizing the warning signs quickly can make a tremendous difference. For many adults over 50, stroke awareness isn't just about protecting health. It's about protecting independence, the ability to walk confidently, the ability to enjoy retirement, the ability to spend time with family, the ability to continue living life on your own terms. So, let's review those 4 letters one final time. Face, arm, speech, time. A simple reminder that could help you recognize a stroke when every minute matters. Health organizations including the CDC, the American Stroke Association, the NHS, and the Heart and Stroke Foundation all emphasize the same message. Recognize the warning signs, act quickly, and seek emergency medical care immediately if a stroke is suspected. If you found today's guide helpful, consider sharing it with a spouse, friend, neighbor, or family member. Many people learn about stroke warning signs only after an emergency occurs. A simple share today could help someone recognize the signs sooner tomorrow. Thank you for spending these few minutes with me today. Take care of your brain health, take care of each other, and I'll see you in the next guide.